Hello, everyone. My name is Rabbi Sam Schapera, and I am the program director at Northern Hills Synagogue. And I'm really excited to be joined here today by Melissa Rosen, who is the director of training and education for Sharsheret. And before I explain what Sharsheret is, I'm actually going to turn that over to you, Melissa. So Melissa, can you tell us what is Sharsheret and what are some of the services that Sharsheret provides?
Absolutely. Thank you for having us. So Sharsheret is a national nonprofit organization. The word Sharsheret actually means chain in Hebrew. The idea being we are all links in the chain of support when someone is facing breast or ovarian cancer. And we provide free emotional or psychosocial support to Jewish women and their families who are dealing with a breast or ovarian cancer diagnosis or who know they have higher diagnostic risk because of family history or a genetic mutation. Some of the programs that Sharsheret offers on the clinical side to provide that support are formal programs that help a woman and her family navigate the cancer experience. So it could be anything from peer support to a program for families who are facing cancer while raising young children. I love this program. The children get a huge box of age-appropriate toys, interest-appropriate toys, and underneath is a sealed envelope for the adults in the household about how to talk to children about cancer in a developmentally appropriate way. It's a great program. We also have a program for caregivers. We have a program for women who are facing metastatic or advanced disease. We have an amazing survivorship kit that's all about living healthfully after a diagnosis, both emotionally and physically. Comes with a gorgeous cookbook, comes with exercise bands, and all sorts of life-saving and life-enhancing information. And in addition to those formal services and more, we have a fantastic team, clinical team of social workers and a genetic counselor who answer calls all day, every day, 9 to 5 in every time zone. And those questions can be something very simple. I need to find a wig. Where can I find a low-cost wig in my area? They could be far more complex. It could be, my doctor just called and she says it's malignant and I really don't know what to do now. And please help me. They're there to listen to you vent, help talk through ideas, connect you to appropriate resources, explain test results in the case of our genetic counselor, really. And all of the services we offer are 100% individualized, 100% confidential, and 100% free. And the idea here is that this is the barriers to get the support are very low, but I just want to be clear that the services Sharsheret offers aren't for people who don't have resources, whether they're financial or emotional or support resources at home. They're for everyone. They're meant to complement what you get from wherever you live, from your family, your community, your doctor's office. They really are for everyone. And I'm really proud of the work we do. It really has an impact.
Wow, you should be proud. I mean, that's much more than I expected you to say. So
there's more too, but that's our clinical stuff. On the outreach and education side, we educate communities about how to identify risk, manage it, mitigate it, how to care for a friend or loved one who's facing illness. We work to train healthcare providers on cultural competency during cancer, and rabbis and Jewish professionals on how to best support their congregants or community members who are facing a diagnosis. I mean, I think the most important thing we know is that facing a cancer diagnosis makes you feel different. All of a sudden in your mind, you're thinking about things different than the rest of the people in your sphere. And physically, your day-to-day schedule has changed, your ability to participate in things have changed. And what we want people to understand is being diagnosed with cancer doesn't make you a less valuable member of the community. And so that's one of the reasons we work with Jewish professionals, because it's not just about doing something nice for someone, doing a chesed, a mitzvah. It's really about reminding them that their value to the community has not changed despite their diagnosis.
And that's so important, because I'm sure that we feel like just so isolated when a diagnosis happens. And a lot of those experiences, for yourself, because you are a survivor. Can you talk about how being a survivor has impacted the work that you do?
Absolutely. I am a 2-time cancer survivor. Over 20 years ago, I had Hodgkin's lymphoma, and then over 6 years ago, I was diagnosed with breast cancer. Interestingly enough, a result of the treatment from the first cancer. But I've always worked in the Jewish community. I've always worked in nonprofits, but after my second diagnosis, I felt I needed to move within a different direction. And I have several social worker friends who said to me, Melissa, think about this before you do this. Do you really want to immerse yourself in cancer day in and day out? It might be a trigger. It might be more difficult than you think. And the reality is that I think it's the most empowering thing that I've done. I basically not only have I kicked cancer's butt twice myself, but I'm helping other women do it. And I'm doing that from a perspective of, I know what you've gone through. I've been there. I don't just sympathize, I empathize. And although I'm not a member of the clinical team at Sharsheret, when I go into communities, either virtually now or travel into communities to speak, I really can offer that dual perspective, which I think helps. Because another thing we know at Sharsheret is that hearing the stories of others helps people internalize the message that we need to be proactive about our health, or that we need to accept support if we've been diagnosed, or whatever the particular message is on that particular day.
Thank you. Thank you for being here and doing all the work that you do. I know it's so important. And even this, being here and kind of reducing the stigma in especially the Jewish community, that, breast cancer is much different now than maybe it was even 10 years ago. So one acronym that comes up a lot is BRCA. You're talking about being proactive. And can you explain what BRCA is and why it's important to know our own status of that?
Absolutely. So BRCA is something that many of us have heard of. Very likely you've heard someone say something like, oh, I have the BRCA gene. So interestingly enough, we all have BRCA genes. The purpose of those genes is to prevent excess cell proliferation, to repair minor damage within our bodies. The problem is is when they're not working, when one has a mutation. And the BRCA mutations seem to happen with much greater presence, or happen more frequently within Jews of Ashkenazi descent. Which is most Jews in America. There is some research out there that it may happen in other Jewish communities too, but in the general community, if we took the entire state of Ohio, for example, and we counted men and women and people of Jewish background and people of other faith communities or other ethnic communities, the number of BRCA mutations would be somewhere between 1 in 500 and 1 in 800. It's a pretty rare mutation. For Jews of Ashkenazi descent, that number isn't 1 in 500 or 1 in 800. That number is 1 in 40. And so even though hereditary breast cancer or ovarian cancer diagnoses is still a very small percentage of those diagnoses, for those who carry one of these mutations, we need to treat ourselves differently. We need to be proactive And in fact, actually, the entire community needs to be proactive to learn about this. One of the ways we can be proactive is learning our status. It is, again, a small percentage, yet if you have it, your risks rise dramatically for a diagnosis of not just breast or ovarian cancer, but actually we know those mutations are related to a few other cancers, including male breast cancer, pancreatic cancer, prostate cancer, and melanoma. So you see that this is a men's issue and a woman's issue. It really is a community issue. And you can, the screening for BRCA mutations is very simple. It's either a quick blood draw or a saliva test, and you can find out your status. At this point, most people don't just get BRCA screenings, they get full panel screenings because there are other mutations that can raise rates as well. And since the prices have come down, it's really not prohibitive once you're getting the screening to screen for all the mutations we're aware of. You know, again, I want to just emphasize that men and women get this mutation in equal numbers and pass it down to male and female children in equal numbers, because so often we'll hear people say, oh, it's a woman's thing, it's a woman's mutation, and it's really not. Men can be impacted just as women can be, and men can pass it down to a child just as a woman can. And so the way to get a screening is to learn your family's cancer history. Note all cancers, note if you know when a person was diagnosed, and bring that information to a doctor, whether it is an oncologist if somebody already has one, or an OBGYN, or a primary care physician. You could also bring this information to a genetic counselor, including one at Sharsheret. And together make the decision, does your family history warrant a screening? And then take the results of those screening, in addition to family history, in addition to personal medical history, and make a screening plan, not a genetic screening plan, a cancer screening plan with your healthcare providers. It could be after all the information is gathered that the doctor says, you know what, you have pretty standard risk and you should just follow the regular guidelines that the government puts forth. It could be that the doctor says, you know, you tested positive for a mutation, and so we're going to change the way we screen you. We might screen you earlier, begin earlier or more frequently, or in different modalities. And that way you know you're being proactive. Now, the other thing I'll add to this is you've gotten this far, and that's great, but now you need to stick to that plan, make those appointments. Don't cancel those appointments. It's really important because as adults, right, we're so busy, we put ourselves at the bottom of our list, particularly women, but all adults are guilty of it. And so we need to remember that we need to care for ourselves the way we would care for every loved one. And it's important to keep that in mind. And if that's not enough, think of it as a modeling behavior. You know, you talked about reducing stigma. So not only do it, because how will your children, whether they're 3 or 33, know it's okay to care for themselves if they don't see you doing it, but also tell people you did it. Oh, I went for my annual mammogram. I hate those, but everything's good. And now I don't need to worry about it for another year, right? Reduce that stigma. It's okay to let people know you're going for preventative screenings. It reminds them they need to do the same.
Right. It's okay to take care of yourself.
100%.
For sure.
Yeah.
So you talked about, you know, going for screenings, getting this, the blood test or the genetic test. What are some other really practical ways that we can continue to take care of our bodies?
Absolutely. So, you know, all of those things that doctors tell us to do that we don't want to do, the moving more, the eating less or better, stress reduction, all of those things actually impact whether one carries a genetic mutation or not. I was actually shocked at how impactful those healthy living behaviors are on risk. And so if we're eating well, I'm not telling you not to have latkes on Hanukkah or not to have kugels on Passover. Definitely do. But the idea that if most of the time when you sit down, your plate is filled with healthy grains, whole grains, and colorful vegetables and a lean protein, that means you can have the donut or the chocolate covered matzah or the birthday cake or whatever it is. In terms of moving more, again, not asking anybody to run a marathon. That's a big commitment. But to go out once a day with a friend or with family members, walk around, get your heart rate up a tiny bit. That's a great way not only to increase the physical activity you do, but it actually helps with the third thing I mentioned, which is stress reduction. Processing your day with a friend or loved one is great. Listen, I know that 2020 is not the year to ask anybody to embark on a stress reduction program, but all we can do is do our best. So whether that means connecting with friends or loved ones, whether that means sitting for 5 minutes twice a day and doing deep breathing, or going online and taking a meditation class or a yoga class or something like that, all of these behaviors are part of caring for ourselves, and they're win-win. They don't only just reduce breast cancer risk, but all cancers and heart disease and diabetes and dementia. These are win-win behaviors, and the earlier you start, the better, but it's never too late to start on these kind of things.
And if I can just add one more thing, is therapy, getting a really good therapist or a counselor. I'm a huge proponent of that. And I think, even if we don't think that we need a therapist, having a therapist is probably a really good idea.
You know what? Absolutely. Mental health is just as important as physical health for our well-being. 100%. There are actually studies that show that meeting the emotional or non-medical needs of patients improves medical outcomes dramatically.
Yeah, we're all connected.
Yeah, 100%.
Yeah. Well, you meant one of the things that you mentioned, to reduce stress is being with a friend and having somebody there who will, listen to you kvetch or listen to you brag about, whatever's going on in your life. And many of us who may be listening do not have a cancer diagnosis, but, we do want to be supporters, or I don't know if we can use the word allies, for people with cancer. So what are ways that both as a survivor and as a professional you have found is the best way to support someone in our lives who is suffering from a cancer diagnosis?
Absolutely. So there are a lot of concrete, practical things you can do, but let's start with an overarching thing. We tend to believe that providing support to someone is intuitive or instinctual, and let me just tell you, it's not. and as someone who has spoken to women across the country who have dealt with cancer, and as someone who's dealt with it myself, it's really amazing the things people will do they think are helpful. But what I'll say is the best thing to do is to find out what they need, but don't do it by saying, what can I do to help you? Right? That is what we all do. It's the first thing. What can I do to help you? But it puts the onus on the person who's already ill, who may not know what they need, may be too overwhelmed to figure out what they need, or may have real difficulty asking for help, particularly if it's someone who's used to helping other people. So the better thing to do is to find some practical things and then offer those forward. In other words, I'd like to drop a meal off. Is Thursday at 6 okay? If you don't eat it right now, it's totally, you can put it right in the freezer and use it for another time. Or say something like, I'm headed to the market, or I'm headed to Target. Is there anything I can get for you? You don't realize how, until you can't leave the house because you're either in the middle of treatment or because you're today immunocompromised, and leaving the house is a far more dangerous thing. You don't realize how critical it might be for someone to pick up milk or toilet paper when you can't go out and do it yourself. In different times, I would encourage people to say, I'm taking my kids bowling on Sunday. Can I pick yours up too and bring them with? Today, a similar offer might be, my teen is really willing to help over Zoom your children with homework on the days after your treatment when I know you're more tired. That's definitely a very helpful thing right now. Checking in is great, but ending those check-ins, whether they're by email or text or even leaving a message on a phone, is great. But end it with, you don't need to call back, you don't need to respond. I just wanted you to know I was thinking of you. Because believe it or not, it's actually exhausting to respond to so many well-meaning people. And we know they're well-meaning and we're grateful for it. But sometimes all we want to do is rest or just have a few moments to not think about cancer. And then I guess the other piece of advice I would give is to follow the person's lead. If a person is not talking about their diagnosis, it may be that it's the time to share a little innocent gossip or to talk about what's going on in your life or the kids' lives. If the person is talking about logistics, maybe they want some help organizing. Then again, a person may be speaking about their cancer experience, and in that case, be a listening ear. Let them vent. Do not try and solve their problem. You can't, but being that listening ear is a gift in and of itself.
It reminds me of kind of a Jewish custom is when you're with a mourner and you don't speak first. You kind of let the person who's mourning, who's suffering and going through the experience, start the conversation. And just having the presence of being next to them is really important.
Yeah, it really is a beautiful form of support that people don't always realize is so very meaningful. Mm-hmm. Yeah, absolutely.
Yes, well, bringing it back to Judaism, we will be having a presentation on February 3rd, and Melissa, you'll be with us then live, so people will be able to join us and ask you questions directly. And we'll be talking more about what is Jewish specifically about breast and cervical cancer.
And ovarian cancer, yeah.
Ovarian cancer. So what is Jewish about breast and ovarian cancer? Because we've talked a little bit today about the Jewish connection to the BRCA gene, but I'm sure that there is much more.
So much more and beyond the genetics, and so much we can do, like we had talked about, to be proactive or to support somebody within the Jewish community. Absolutely.
Yes. So before we go, is there does Sharsheret have a helpline that people can call if they need to?
Absolutely. So there are several ways to get in touch. And again, you don't need to have a diagnosis. You may have questions or are looking for support as a caregiver yourself. There are a few ways to do that. You can go on our website, which is www.sharsheret.org. And I'm going to spell Sharsheret because as a transliteration, it's something that gets wrong very often. It's not an easy one. So it's SHARSHERET.org. You could also email us at info@sharsheret.org, or you could call 866-474-2774. And any of those ways can connect you to a member of our clinical team, to me, to whatever you need. We'll be there to help.
Wonderful. And I'll put all of those emails and the website and the phone number kind of right over here so that people will be able to see it on the screen.
Fantastic. Fantastic.
Okay. Well, Melissa, thank you so much for joining us today and giving us a little background about breast cancer and how it really does affect everyone and not just the people who have the diagnosis. And I'm really looking forward to seeing you again in February.
Very excited to come back. Absolutely. Thank you so much for this.
You're welcome. All right. Well, So I'll say goodbye to everyone, and we'll see you soon.
See you soon. Bye-bye.